4 years after COVID-19's pandemic shut down most of the country and killed nearly 1 million Americans, it's important to remember that the virus is still here. We are seeing an uptick this summer in COVID cases, so we still need to be aware and reminded of how to avoid and prevent COVID-19. Joining us with a COVID-19 update is Dr. Ben Weston. He is Milwaukee County's Chief Health Policy Advisor and an Associate Professor in the Department of Emergency Medicine at the Medical College of Wisconsin. We appreciate you being with us again, Dr. Weston.
Good to see you, Denise.
What does the summer uptick of COVID-19 look like?
So we've seen these upticks the last few summers, and we're seeing it once again. And so what it looks like for most folks is having friends and family coming positive with COVID. Now, luckily, most of those people, due to vaccination, due to previous illness, all the immunity that we have are fairly mild cases. Some don't even have fever. Some it just feels like a cold. But of course, for people in the higher risk category, that tends to be older folks, people with immunocompromise. For those people, it can mean much more severe illness. And so unfortunately, we do see a bit of an uptick in hospitalizations as well.
So people are still being hospitalized for COVID-19.
That's right. Both locally and statewide and nationally, we're seeing this summer an increase in hospitalizations. Now, to be clear, it's not even close to the increases we saw at the peak of COVID. But we are seeing an uptick. And so that means we have to remember about our more vulnerable members of the community where COVID isn't just a little bit of a cold that they get over, but it still can be more severe disease. And that's where vaccination and prevention comes into play.
Let's talk a little bit about what variant is out there. What is the variant that's out there now? And is it different in terms of symptoms from what people may think about with COVID when we were in the midst of the pandemic?
So the variants are still this alphabet soup. We have KP3, KP2. They're often called the flirt variants. So these are the variants that we're seeing out there right now. Really, it's the same sort of symptoms that we've seen before. But again, due to immunity, more mild sort of presentations. And so it still is the cold type symptoms, the cough, oftentimes fever, body aches, things like that we're seeing still with these flirt variants.
So if you have COVID, if you test positive for COVID, and you're in one of those risk groups, what do you need to do?
Well, let's start even before you test positive for COVID. So you want to get yourself vaccinated, and that's whether you're in the risk group or not. Listen, if I get COVID, I'm going to be out for a few days, maybe even a week, and then I'm going to spread it to my family, and it's just going to be this ongoing cycle. So I don't, even though I don't think I would get terribly sick if I get COVID, I still don't want to get it. And getting the vaccine is an easy way to prevent that. Now, certainly if you're in one of these high-risk groups, you want to prevent COVID as well through vaccination. But to your question, if you get COVID, you want to stay away from others. You don't want to transmit it. But if you're in one of these high-risk groups, you want to talk to your healthcare provider about Paxlovid or Molnupiravir. These are the medications that prevent that development of more severe illness and hospitalization, which nobody wants to have. And so if you're in a high-risk group, certainly give your healthcare provider a call, tell them you have COVID, tell them you're interested in Paxlovid or the other medications that can prevent more severe symptoms from COVID.
Is there a little bit of vaccine confusion out there? For a while, when boosters were available, you had to be of a certain age, you had to have other risk factors before you could get the vaccine. Now, is it available to anyone?
Yeah, listen, COVID has been a confusing landscape for several years now, but I think they are working to simplify it. And this fall, it'll be about as simple as it gets. So the new updated COVID vaccines, they're not boosters, they're updated vaccines. They target this newest variant to keep your immunization up to date. And so they're going to be available for anyone. Age 6 months and older, you can get this vaccine as soon as it comes out, which will probably be in August or September. And so anyone 6 months and older, it's quite simple. You go out, you get the vaccine, and you can have increased protection against the most commonly circulating variants out there.
And when we look at those vaccines, how long are the vaccines going to be able to offer us protection?
Yeah, so it's been variable. Obviously, we have a new updated vaccine coming, and so we don't have as much research on that one and how long it should last. But typically, we're seeing anywhere from 6 to 9 months of protection from these vaccines. And that is where a little bit of an exception, more vulnerable folks, older, immunocompromised, can get an update partway through the year. So if you think you're in one of those groups, come winter, spring, talk to your doctor, talk to your pharmacist, talk to your healthcare provider about getting that updated, another dose of the updated vaccine. But this fall, it's very simple. Anyone 6 months or older is eligible to get the updated COVID vaccine. And while you're doing it, get that flu vaccine as well.
Wanted to ask you about that. I don't want to be the person who says it, but we know that fall and winter are coming, which means we're going to be in flu season. It's not too early to think about getting that vaccine.
Yeah, it's not too early to think about it. So maybe it's time for your annual physical with your doctor. Call, schedule that in September, and you can get both vaccines, knock them both out at the same time. One arm for COVID, one arm for flu. Get your protection and get it done.
One other quick question. Should we still be wearing masks as we look at these upticks, or if we're vaccinated, if we take other precautions, is it still necessary to mask?
Well, let me take that in two parts. So the first question is, the word mask is pretty broad. So when we're talking about a mask, it could include a cloth mask, it could include a paper mask, or it could include a KN95 or N95. I'll tell you, I've moved away from cloth masks altogether. I've moved away from the paper masks pretty much altogether. They just don't give very sufficient protection if you actually want that level of protection. Now, the next part really comes down to a personal decision. What is your risk tolerance? What is your risk profile? And do you or do you not want to wear a mask in certain situations? Certainly going for a walk in the park, you don't really need to be wearing a mask. But if you're indoors in a crowded space and COVID levels are high and you're in a vulnerable population, you have immunocompromise, you have other health conditions that you're worried about, you're in older age groups, or you're just worried, certainly go ahead and wear a mask, and I would wear a high quality mask. I'll tell you personally, I don't wear a mask very much anymore. I have my vaccine. I've had COVID before as well. I think my immunity is relatively high, but there are certain circumstances on an airplane, for example, where I still will wear a mask, especially when it's on the ground and there's not much air circulating. I'll wear a high quality KN95 for that short period of time. But generally, I'm not wearing it too much anymore. But that is a personal decision that people make.
Well, thank you so much for the advice. We appreciate your support, and thanks for letting us know that we need to start thinking ahead for a couple of different vaccinations this fall.
Absolutely. And if it goes without saying, but it's also getting to back to school time. And so think of getting your kids updated on all their routine vaccinations as well.
Thank you. We'll be back in just a minute with a look at one effort to keep Milwaukee streets safer from gun violence.